Vicky Linnane and welcome to Embrace Therapy podcast. I am a practicing art therapist based in Ireland. In each episode, I will interview guests from various fields of therapy and well-being with the aim to encourage healing through embracing therapy. My guest on the podcast this week is Dr. Pat Bracken. He is a consultant psychiatrist who recently retired from his position as Clinical Director of the West Cork Mental Health Service. I spoke to Dr. Pat Bracken back in June to discuss Men's Mental Health Day and the use of creative arts therapies in men's mental health services. As Pat is one of IACAT's ambassadors, I would like to thank IACAT for this opportunity to connect with Pat and to once again promote the work of creative arts therapists. In Ireland, September is a time when we wear a green ribbon to spread awareness about all mental health difficulties and to end stigma around having mental health issues. Sea Change have been doing this for 10 years now, and this year's theme is No Shame in Having a Mental Health Difficulty. Just to say, I'm not affiliated with this charity, but commend them on their dedication in this endeavour to end the stigma. I wanted to launch my next series of podcasts on September 10th for World Suicide Prevention Day, to encourage men to reach out to their local support services or registered professionals working online. It was a really gorgeous conversation with Dr. Pat Bracken, and I hope you enjoy it. Off that, this week is Men's Mental Health Awareness Week. It's running from Monday the 13th to the 19th of June. And as IACAT always do, we do live Q&As to kind of highlight where we are working. And I suppose with days like this or awareness weeks like this, it's perfect time and opportunity for us to show, well, this is the area that we're actually in already, and highlighting the work that we do. I wanted just to start off by saying that, toxic masculinity is everywhere at the moment. It's kind of one of those buzzwords as well. But how can we encourage men to let go of hyper masculinity, and how do we start that? I think you mentioned before how you kind of need to have a sense of hope and purpose and meaning to make changes in your life. But how can we actually get that across to our men? How do we instill some hope into our young boys and men of Ireland? How do we do that?
Well, I think it's already starting, Vicky. I think those conversations are, beginning to happen in a way that would have been unthought of, 20 years ago. I think we are starting to think about the way in which we what are our priorities as a society? What are our goals? What do we want to pass on to our children? What values? What as I said, priorities we want to instill in a younger generation. I think is starting to change, but it's like a lot of things. We go 1 foot forward, 2 foot backward. You know what I mean? But I think there is room for hope. I think we've become a lot more sensitized to issues around toxic, as you put it, toxic masculinity, and the effect that has, not just on women who are often the victims of toxic masculinity directly. We're hearing a lot just right at the moment about the horror of domestic violence, and so women are often victims directly of toxic masculinity, but also I think men are, and so it's not something that actually, it is in anyone's interest to just maintain a kind of, not to confront the issues and to engage with them. I think it's useful to have a week where there's a focus on men's mental health. Not that I think, from my experience, the same issues face men and women, in terms of mental health, in terms of how you deal with mental health crises, in terms of how you get help for yourself or for a member of your family. All those same issues and difficulties face all of us. But the striking thing, I suppose, when it comes to a gendered look at mental health issues is the suicide rates, and the fact that men kill themselves for whatever reasons about 4 times more often than women do. That's a stark reality. That's a stark statistic. And in Ireland, that gender imbalance is a bit higher than in the rest of Europe. I mean, it's an international trend. It's not just in Ireland, but our figures are that bit more stark, and there's been an increasing concern in recent years. There was a lot of focus on young men, 10 years ago in the 15 to 30 kind of bracket, because suicide is one of the leading causes of death in that particular group. I think it's the second largest after road traffic accidents in that. It's a major kind of cause of death. But there's increasing concern, I think, for middle-aged men, because the suicide rate in middle-aged men is going up in the last 10 years. And that's, even though the overall figures for suicide have started to go down a little bit in the last 5 to 6 years, that rate amongst middle-aged men is very concerning. And it started, the growth in that seemed to start with the recession back in 2008, but it's continued. And I think so there's a lot of concern around that particular group, and a lot of, I suppose, thought as to how we engage men, to come for help and seek support rather than going down the route of suicide. And so I think that's a big issue that I think we should discuss, that we need to think about. And there's no easy answer. There's no simple solution. Suicide it's about mental health, but it's about many other things as well. That's for sure. And I think we need a very broad-based national discussion about that issue. So I think it's important to maybe start with that.
Yeah, you touched on so much there. I suppose one of the things that I've kind of come across, I love Gabor Mate, and I watched one of his discussions with Russell Brand, and they were really talking about just what you said, that like it doesn't benefit anybody really, for us not to look at these issues, to not tackle them. But then when you stand back, and again, it's like, well, society kind of does benefit from us having addictions, that like, we go out and we shop, we go out and we drink. And I suppose in a way, maybe there's a little bit more to it in a societal kind of way as well. It's quite sad, really, how I suppose culture and economy can kind of create these issues, and then actually in some ways, in some areas, kind of get some benefit from it. So it's quite it's quite disgusting, really, when you look at it from that side of you. But
yeah, sure. I mean, we live in a capitalist economy, and there's always money to be made, and that seems to be a priority. We judge our national performance in terms of GDP. That's how much profit's being made by companies, and rather than judge how we're doing as a people, as a nation, by how well we care for each other. I don't think we need to be too hard on ourselves in Ireland. I look at other parts of the world and the politics that have emerged in, the likes of North America and our neighbors next door in Britain and in other parts of Europe, and I think Ireland, I'm relatively proud of the fact that we haven't produced right-wing demagogues who trade on, simplistic solutions. We don't seem to have been infected with that. And I think that's kind of to the credit of our whole society and our politicians, across the board. I mean, I think there's, we should not everything is terrible, and I think there are some things in Ireland we've done well and we should be proud of in the last 20, 30 years. I think we've managed to get ourselves out of the grip of a very toxic Catholic Church, and we have a much better relationship now, I think, with religion and spirituality than we did when I was growing up, where it was an oppressive force, and I don't think it is now. I think we're dealing with it, and I think there are lots of things to be positive, but I think just judging how we're doing in terms of our country, in terms of GDP, is we need to get away from that. And as you said, I think we need to become more aware of how the nature of capitalism, and that idea that we can commoditize things, that there's always a profit to be made from, anything at all, like even the world of mental health has become almost commoditized. And as you probably know, I would categorize myself as a critical psychiatrist, and I've been part of a movement, I guess, across the world that is very concerned with the way in which mental health has become dominated by pharmacological solutions and the accompanying discourse around diagnosis, the idea that the way to deal with mental health issues is to stick a label on it and then get a treatment for it. And if that treatment doesn't work, well, you get another one. And that, I think, that whole logic behind that can be tied into the way in which our economy functions, the way in which we think. We've been tutored to think about that, the best way to deal with problems is to treat them like commodities that can be, you can develop a service to fix. And I think mental health is a lot more complex than that. And it requires us to develop a much more nuanced way of thinking about and responding to mental health issues. It's just not good enough to think and to tell the public time after time, this is all about neat, discrete illnesses, whatever that is, that you can put yourself into a box, or a doctor can put you into a box with a label on it, and that somehow explains what's going on for you and guides you towards getting better. I think that model of mental health is extremely limited. It has made billions in profits for pharma, but mental health professionals are not immune from criticism in this, because it's also served a whole cadre of people who've come to work in mental health and who work on fairly simplistic basis as well. So I think we need health is a critical consciousness, that we need to start to embrace the idea that thinking critically about our history, about our assumptions, about our values, that critical orientation is not a negative thing. It's not a knocking. It's actually an opening up, and it's a positive thing. And I think we have to start engaging with the idea of critical thinking as a positive force for mental health. And I think I look forward to a time when all mental health professionals, not just doctors or nurses or therapists, but anyone who comes to work in this area, will start to see the necessity of thinking very critically about what they're doing. Putting names onto things is not an innocent act. It's a very powerful act. Providing a treatment for a specific illness is not a neutral thing. It's guiding someone towards a way of thinking about themselves or their loved ones that actually prioritizes certain ways of looking at it and neglects others. So everything we do as mental health practitioners, every engagement we have in the lives of ordinary people who come to us with all their messiness and all their struggles and all their pain and sorrows and difficulties, when we intervene in their lives, we are involved in political acts that shape the way they are going to deal with themselves and their families. And I think if we don't think critically about what we're doing, we are in danger of doing a lot of damage. And we have done a lot of damage to people. There's my own profession of psychiatry, our history is a terrible one. And I think, we probably more than any other professional group have to embrace that idea of criticality more, because if we don't, we'll keep on doing harm, I think, to people, Yeah. So I'm not sure how I got onto that, but
it's a beautiful flow, because to be honest, like you studied philosophy.
Yes.
I did my undergrad. One of my subjects was philosophy, so critical thinking is very much like
you get it. Yeah,
I get it totally.
Yeah.
It's so important, and it's I suppose as an art therapist, I don't question myself. If if I'm not in supervision with my supervisor and I'm not questioning myself, I know I've let something slip, something's not right, so that you kind of have to have that critical lens, I suppose, to do this work in a kind of ethical and moral way. But to come to the place, I suppose, of coming on from that, I remember one time I was working in one of the Matt Talbots, I won't say which one, and again, it was, primarily men of a certain age, 30s to 50s, and the people in there were coming from certain backgrounds and had been brought up to think that they didn't have any future or any hope. So they all kind of got into drugs and like crack and heroin. They were the kind of ones that they were all kind of addicted to. But the thing that I noticed as an art therapist going in there was actually the people around me, my supervisor at the time, management and things like that, weren't thinking about them being responsive to art therapy. They didn't think that they would do it. So ultimately, I was going in and they had no hope for this to work. And that was just so sad to start off that way. But it was amazing, really, how they actually did go places, and it became almost a spiritual kind of way as well. Like they really looked at themselves from a different perspective and like cried and like really like embraced this opportunity to change and to kind of map out their inner world. Like it was just gorgeous to give them that space for reflection and expression, and the work was really powerful, but again, a kind of area where people just are giving up, I suppose. They think that that's just it for them. They don't think they have any reason to go on or to do things, like art therapy. Why would I be doing that? But once they did have it, they really did use it, and it was amazing work. So like again, like art therapy and all the creative arts therapies can give rise to vitality, and it creates inner change. And that's a study that I found on online there today that really just shows exactly my process in one experience. Like I'm just naming one experience, but how creative arts therapies is a great opportunity there for Ireland, especially with men's mental health, because again, it's kind of easier to sit with somebody when you're doing something, number one, rather than just sitting and talking it out. And then also the focus isn't just on you, it's on what you're doing together. So it is a collaborative kind of part to it as well. But the creativity, which I know you're very passionate about as well, part of it is it's just part of the mental health. Like it's like when people get to a certain part of their life and they become really ill, it seems like creativity is the only, for me anyway, the only bit of hope. you know,
Yeah,
otherwise, like you said, there is medication and that, but like, I think for me, having seen it again and again, it just works, when you have that relationship with a therapist and you use creativity. So I'd love to hear what you think.
absolutely. I mean, I agree with 100% with what you're saying there, Vicky. What I've learned, and I've been working as a doctor in the field of mental health for, golly, a long time, nearly 40 years now. And I've seen many changes. I mean, in Ireland, I've worked in England, I've worked in inner cities, rural areas. I've worked in Africa, New Zealand, and lots of other places. And what I've learned more than anything is that mental health issues are not straightforward. That we wish they were. We wish it was like having a broken bone and you go to a hospital and you get a plaster on it and you go away and it's fixed. It's not like that. Sometimes problems are fairly simple. Something is bugging someone and it drags them down, and there's an easy solution comes along and they get over it and they move on in their lives, and that's fine. But for most of the people I've seen over the years, it's more messy than that. People don't fit into neat boxes. Their problems come from all sorts of things. Yes, they come from physical issues in the body, sometimes from health issues. They come from relationship issues. They come from traumas in childhood and in adulthood. They come from the hopelessness that goes with poverty. They go with the hopelessness that comes with unemployment and not having a role and a goal. They come from living in deprived neighborhoods. They come from all sorts of things in our lives as human beings, feed into this stuff we call mental illness. And I think our job as professionals is to try and deal with that messiness, not by denying its existence and trying to fit everybody into boxes of our making. But we do need to help people find coherence. It's no point us saying, oh, it's all too messy. We can't, it's golly, that's complicated. I don't know where to start. Our job is to try and have that conversation with people, which starts to help them move to a place where they get some handles on what's going on. And that often is a language. That's often some ideas about what might help, or examples of other things you've dealt with somewhere else that might be relevant, all sorts of things. As a mental health professional, you bring all of that into your work, and you try to help people to move to a place where they're starting to get some levers on their life and levers on the kind of problems that they have. But what's happened, I think, in what I've seen happen in the 40 years of my career is a narrowing of the menu, so that it's gone from, where there were, psychoanalytic ideas, there were social psychiatry ideas, there were all sorts of stuff. We've narrowed the menu down to medication and a little bit of CBT. And that seems to be the solution to, you look through most of the textbooks of psychiatry or psychology or whatever, it'll be, if you've got depression, anxiety, trauma, psychosis, whatever it is, there'll be medication and a bit of CBT. That'll be the answer to most things. And for me, okay, that works for some people. Yeah, I don't deny it, that some people find that road the one that helps them to move on. But for a hell of a lot of people, that's way too limited. That's not going to help them. It doesn't offer a pathway towards hope and recovery. And our job as mental health professionals is not to try and provide all the different pathways. We can't, none of us can do that on our own. But it's to be aware, I think, that there are different pathways out there and create the conditions in our services so that people can find them. And you said I'm passionate about the creative arts. I am, because I think what I see with the creative arts is that offers a whole set of pathways through along which people can move towards recovery. It's not going to work for everyone, but I think it does work for a lot of people who don't, for one reason or another, they don't respond to medication. That's not working for them. And CBT, or talking therapy, sitting down in a room with another human being and just talking about yourself, that's not comfortable for a lot of people. A lot of people just don't get that, or they can't do it. And in the context of our discussion today, I think a lot of men don't find that the easiest way of doing things. I think a lot of men are brought up to be practical, and often they will talk about themselves by talking about something else, if you know what I mean. They'll talk about sport, they'll talk about farm machinery, they'll talk about, the weather, they'll talk about politics, they'll talk about all sorts of other things. And in that, they will be discussing where they are at themselves, but they won't say, this is the way I'm feeling. It's just not part of, I worked in rural Ireland for quite a long time down here in West Cork. I've worked with all sorts of men from different backgrounds. And you have to be able, as a mental health practitioner, to step out of the usual role of saying, right, tell me all the symptoms that you have and let's confront them one by one, as you would do in a kind of CBT approach or whatever. You have to be able to have conversations on that person's home ground, so to speak. And I think the solutions that we need to be thinking about for all our people who come for help, not just men, but maybe in the context, as I say, of this discussion, maybe particularly men, we need to be thinking much more broadly about what kind of things can be helpful to them. One of the things I've seen, for a lot of people, again, it's a minority of people, but it's very helpful, is swimming in the sea, and I see it down here in West Cork. A lot of people, particularly women, actually have just taken to going to the sea, and they find that hugely beneficial. I don't know why, but they do. And there's a communal aspect to it. There's a challenging yourself aspect to it. There's an overcoming the coldness, and you get a sense of satisfaction from that. There's all sorts of reasons why that is. I've seen, men with men's sheds, coming together, working practically on a problem together, and in that sharing them, what's going on for them and finding a sense of camaraderie and support. There are lots of initiatives now like woodland walking. There's a whole kind of range of things that I think we need to be embracing, and the creative arts, music, art, drama, all sorts of things have to be part of that agenda, and not just seen, I think, as you were describing, seen as a kind of an add-on or a kind of a nice little thing to a form of occupational therapy, if you like, that keeps people quiet for a couple of hours. I think these are fundamentally important tools for the mental health world to work with, to help people find hope, to help people find meaning, to help people find connection with other people and with a broader set of happenings outside of themselves that make them feel part of the world again. So I think that's it's very important that we work towards establishing the creative arts as a much more integral and important and funded part of our mental health services.
And there's so much neuroscience now backing up everything that we do as creative arts therapists. It's amazing to see, and obviously we all know it because we did the training. But it's lovely to have that now as well. Just looking, for me, I suppose I would always start my sessions with a bilateral drawing, which basically it's a way of using both sides of the brain, and instantly you're engaged full body then after that as well. So it's really lovely. And I suppose there's just, once you have an opportunity to work with somebody in an individual way like that, then like at the moment I'm working with people individually, but I'm putting them then into groups for the summer, and I can't wait, because it's like the most, I suppose, at the moment would be teenagers with social anxiety.
Yeah.
And they've been seeing me for the last 2 years during COVID. And now it's time to actually see what they're like, working together, and hoping that this will roll on then to be a more peer support through creative art. So,
Okay. Excellent. Yeah.
it's
Yeah.
the next step, so
Yeah.
they've got all the insight to themselves and what works for them, and they have this new language, like you said, because that comes with going to someone like me in a therapeutic kind of way. They learn how to discuss their own inner world, I suppose, and then now putting them into a group with people their own age, I just can't wait for it. um and yeah, I wanted to kind of say something about just I suppose culturally. Now, you did say that we're already having this conversation, and I do think that that is the case. Like, for example, even a band, I don't know if you'd be familiar with the band called Idols, but they have this
Don't.
song called they're from Bristol, but they have a song called
Okay.
Samaritans, and some of the lyrics are: man up, sit down, chin up, pipe down, socks up, don't cry, drink up, just lie, grow some balls, basically. But I think it has, even amongst my friend group, it has actually become a thing where it started a conversation, even just them going to that concert, even, um, you know, I suppose there is a shift happening, and I'm
Yeah.
seeing even just amongst my friends, which is really lovely, that they can open up about conversations, and accept that there has been some hyper masculinity, but they don't have to do that anymore. They can let that go, and they can
Yeah.
hug and cry together.
Yeah, absolutely, absolutely. It isn't that you want people to be not masculine. I mean, I think there are positive things about,
Mhm.
masculinity, but it's about us redefining what we want
Mhm.
from masculinity and not being afraid to confront that. And it's like us redefining what we want from our religion. We don't have to have a Christianity that is toxic, that is homophobic, that is misogynistic, that is based on undemocratic history, and that embraces that undemocratic history. We don't have to have that. We actually can define a different kind of Christianity, or any religion, I think,
Mhm.
our spirituality. We can take that back from the priests and bishops and popes who told us what to do, because we need spirituality in our lives. I think a lot of people do anyway. Some people don't, but a lot of us do. But we don't have to just do it in the way that it was done before. And I think how we think about gendered roles in society, um, there are positive things about having femininity and masculinity. We don't have to all be the same, but we can redefine what that is, what that means for us, and have that conversation about what it means, what being strong is, what being, I don't know, even in terms of our sports now, we can start to redefine how we think about what kind of sports we're going to play, what we're going to do in sports, and the rise of, female jockeys, and women playing rugby, women playing soccer, all sorts of things, like, is wonderful, and
Yeah, okay. I'm still here.
are you there?
Yeah.
I'm not sure what happened there.
Something popped up.
Um, Someone's trying to phone me, I think, so I'm going to decline that, and it's interfering. Yeah, sorry about that. uh,
Women are taking I suppose more interest, and it's like, usually there's a great program actually on RTE recently um about the kind of age of 13, 14, and the drop off rate of girls doing sport,
yeah,
and how that is changing, and how the GAA in particular are really encouraging
yeah,
young girls to join and do more sports. So definitely is things happening for sure in our little island, for sure.
yeah. And boxing, for goodness
Yeah,
sake,
yeah,
what was more
exactly.
masculine, what was more men dominated, what was more, now Irish women boxers have occupied that space and, have done a great job, I think. And not that I like boxing, I don't particularly like the sport, but I'm very proud of the women from Ireland who've really, just taken it and owned it and done something with it, and kind of, we've, as I said before, I think we've a lot to celebrate in our little country. There's a lot wrong with it, and as a critical doctor, I'm very aware of the history of our country and the oppressions and the violence that has been done to people, and our need to continually engage and not to rest on the idea that, we've arrived somewhere. We've never arrived. We're always on a journey. But I also think that we have to be aware that we have made progress in a lot of aspects of life here, and things are can move forward as well as move back or be stuck. And I think particularly maybe for us in mental health work, I think you can very easily get into a very negative space. Everything's wrong. There isn't enough this, there isn't enough that. We're not putting enough funding into one thing or another. Services aren't there, blah, blah, blah. And I'm someone who, as I said, I'm a critical psychiatrist. I'm a critical doctor. I will argue about what's wrong, till the cows come home. But at the same time, part of our job as mental health professionals is to instill hope and to bring hope to the world of that we work in. And I think we also have to find the positives that are happening in our services, in our world, in our society, so that we can latch on to that. That's not being complacent. I think that's being bringing hope to our work. And so, yeah, we have to, as well as calling out toxic masculinity, I think we also have to celebrate the ways in which we have moved on in terms of that.
Definitely. There's one last thing I was thinking of bringing up as well, is that something that's been done already in Ireland from a really young age is it's called Roots of Empathy. Have you ever heard of that?
No, that's new to me.
It's gorgeous. So Bernardo's do this.
Mm-hmm.
My little one actually was involved in it. So she was 4 months old, and the whole idea is that you bring in this 4-month-old baby into a second class national school classroom.
Okay.
And they come in for the full year at sporadically throughout the year. And it raises social emotional competence and increases empathy. So basically they learn from her. She's the teacher. So she had this little t-shirt on her. Which
so you bring your child into the classroom. You don't leave the child and walk out and leave the kids throw her around for a while.
It was so gorgeous because I just sat there and just interacted with her normally. And if she she'd engage in some way, like they might give her little rattles and things like that, and they just sit around her in a circle, all engaged, looking at this this attachment basically between the mother and the child. They got so much from that, and they really got so attached to her that at the end,
really,
they really did. They loved it. But that's just a really simple program that Bernardo's provide in certain parts of Dublin. But it should be, I think, all across Ireland in every primary school, because it just was so gorgeous. And it started conversations with them. They really opened up. So anything to increase empathy,
absolutely. It sounds wonderful. It'd be interesting to see how it goes. Is it continuing, or is it kind of time limited?
Yeah, no, it's continuing. I actually got an email from them. They're doing it again this year. So that was 2017. So they've done it every year, and it's huge in Canada. like
Okay.
the
Okay.
lady that started it, she's living in Canada. But it's just to say that there are things like that, initiatives happening.
Yeah.
Positive.
Excellent. Yeah.
Thank you so much, Dr. Pat Bracken, for coming on.
You're more than welcome. You're more than welcome. Yeah. And good
Really
luck with it.
appreciate it.
Yeah.
Thank you.
Okay. All right.
Okay.
Nice to see you, Vicky, and nice to chat with you. Yeah.
Real pleasure. All the best.
Okay. All right. Bye now. Bye.
Bye.